If you suffer from an overactive bladder, a leaky bladder, interstitial cystitis, you deserve to listen to this video. With me right now is a great patient and her daughter. This is Miss Knowles, and they come to my clinic from the Bahamas, right? Mm-hmm. Yes. So one of your symptoms, which we'll start with, though, I think one of the worst that we'll start with, and there's a few different symptoms that we're going to cover here, but one of the worst symptoms was your overactive or leaky bladder.
Right, that's right.
So the leaky bladder, if you can just tell what it was like. I mean, was it just a spot here and there that you had to clean up after, or was it even worse than that?
It was pretty bad. You know, like if I wanted to go to the bathroom and if I don't go right then, it's pretty bad. I would wet myself before I get to the bathroom, or if I lay down like maybe 5 minutes longer, you know, it would come out, it would wet the bed, and I would have to go to the bathroom. By the time I get to the bathroom, it's all down my leg.
It's all down my leg.
Mm-hmm.
And how many years did you, that's terrible, how many years did you suffer with that leaky bladder condition?
That's a pretty long time. I don't remember the exact amount, but it was long.
Long, do you think more than a year, more than 10
No, it's
years?
more than a year.
Yeah.
When I was sick like over 14 years, so it all comes together with the 14 years. So with the leaky bladder, I wouldn't know exactly the amount of years, but it was pretty long.
Pretty long, but more than 10 years.
Yeah.
More than 10 years.
Yeah.
And it was more than 10 years of that severity that you'd have to go to the bathroom, and it would start leaking out on the way to the bathroom.
Uh-huh.
And leaking in the bed.
Yeah.
And that would happen every time.
Every time.
All day.
Yeah,
it can happen
all day. But mostly more than the night during the day. You know, it's like every hour I'll have to go to the bathroom, you know, and it stopped me from having a good night's sleep. Mm-hmm. Yeah, and the day wasn't as bad as the night. You know, every time I lay down, I would have to get up and go to the bathroom.
Wow.
Yeah.
Did you feel pain in there, or did it just feel like the bladder was full and you had to release the bladder?
It was no pain, it just was full, and yeah, sometimes like a pressure to the bottom of my stomach, so I would have to go.
Mm-hmm. And now, after your first protocol, and you came to me in August of 2018, and you just came back to me now, it's February of 2019, and in one visit, 1 2-month treatment, what's happened with your bladder now?
Wow, I was able to sleep. I get up once a night. I get up like maybe around like 1 or 2 o'clock, and I'll use the bathroom, and it's no more until I wake.
And no more. So one time a night instead of every hour.
That's right.
And is there any leaking when you do get up to go to the bathroom at night?
No.
Zero.
No.
100% control.
No leaking.
No leaking. And no wet bed, no wet pants, no wet underwear, no wet legs. Gone.
It's gone.
How many, and that's every day, all day, and how long has it been, right, every day and all day? I'm not putting words out there, I'm saying I'm just repeating what you told me when we first discussed, is that it's every day, all night, you have no more leak.
No more leak.
Zero.
No, I can go all day.
Congratulations. It can happen. And how many doctors, how many places did you travel to for this bladder control disorder?
It's a lot.
Too much to name.
Too much.
Really too much. Like, we've been to Cuba. We've been to a few doctors right here in Florida. We have been to Houston, Texas. And there's been no real results. You know, the results, like whatever they did, whatever treatment that she got, whatever treatments that they did, everything just lasted like maybe a week. Sometime maybe 2 weeks, and then like the whole symptoms come back, you know. And then there have been days where she, you know, she just lays there and cries. What's going on? Why can't they get it fixed? Why can't nobody figure out what's going on? You know, so right now it's a little bit unbelievable that from the time that she came in August, we have seen a lot of changes, you know. And like I said earlier, we know it's a road to travel, but just the amount of changes in those few months, it's, you know, it's overwhelming. It's changed her life a whole lot, from where she was at to where she's at now. And well, I'm her daughter, as you would have already known, and I've been through it with her. I've been to Cuba with her, I've been to Florida with her, I've been to Houston with her, and it's, you know, constantly back and forth, and I'm always looking at the doctors like, really, we're gonna do this again, you know. So right now, to see the results she's gotten in such a short period of time, it's fantastic. One, it's relieving on me too, you know, because it takes a lot of the worries as to, you know, can we really find the help that we really need to get her to where she needs to be, you know. And thinking about coming from those days when we would have actually celebrated when she could sleep 2 full hours, or even sometimes when she could sleep 1 full hour and really got sleep, to now being where I have to be like, time to get up, you know. So it's like I say, it's great that we're now seeing the change.
Awesome.
It's like, it's brought me to tears over and over to see how she's improved so much from where she was to where she is now, and just the hope and knowing that it's eventually gonna get better, you know, and understanding that things may happen, but just to see the improvements as we go along, and see the improvements experienced in the period of time that she's come to see you to where we're at now, it's wonderful. Yeah. You know, it's overwhelming, it's relieving. Yeah. You know, and I know more than anything, this is about the happiest she's been in a very long time.
Awesome.
Yeah.
I'm glad to see your smile. That's great. Thank you for that.
Yeah.
I know it must have been a very difficult journey for the past
Yep.
14, 15 or so years with the suffering.
It has.
And doctors who didn't know what to do. And you've had reason, yeah.
It's been like diagnosis after diagnosis, where, you know, you'd have a chiropractor would tell you it's just like an alignment issue, you know, or it's a nerve issue. You know, we've even been to a doctor where they told me, they said she needed to get a surgery done on her nerves, and I refused. And I told her, I'm not leaving you, I'm taking you home. I don't agree with it, I'm not a physician. And she was upset, but I felt like I was doing the right thing at that time. And like right now, today, we joke about it, like, what would have happened if you had really done that surgery? Mm-hmm. You know, to come to find out that it wasn't a nerve issue. You know, it's just that other things that are going on in your body that nobody never really knew. And then to see that the treatment has resolved so many outstanding issues all at once, you know, it's why we feel like it's really something that really works. Yeah. And I know we're doing a video and it's not pre-planned, but I would say to you, if you're suffering, try it. I would say to you, if you've been through half of what we've been through, where she has been to eating baby food, she has been to having spasms, she has been to having little mild strokes, she has been to the point where she really couldn't walk, she has been to the points where her hands were like full of little black spots, her hands, her feet and everything full of black spots. Look at it. It's, you know, it's back to like where my hand is, you know, somebody that's really been through a lot, you know. So seeing the improvements right now, it's wonderful.
It's wonderful. And it's not unbelievable. It's just it seems too good to be true. But it's remarkable.
It's relieving, because you now feel like you're making some progress, you know, and spending the money, and it's like it's overwhelming that you always gotta spend it, and you're not getting any results from it. So what are you doing? You know, is it making any sense? And there have been points where she really said to me, I just want to go, just put me out of my misery, you know. And to see where she's at now, it's
worth every effort.
It's worth it.
And it wasn't a hard protocol.
No, it was very easy.
Very simple.
So very easy.
And all of a sudden it just started to change.
Very easy.
Others, thank you for all of that input. I appreciate you telling people that. I'm going to mention some other symptoms. We'll just highlight these.
Yeah.
And then if there's anything else you want to say. You said that you had constipation for about 8 or 9 years.
That's right.
You weren't going for once every maybe 2 or 3 days. You might have gone.
And when I do go, I have to take something for me to go. I never go,
You couldn't go without something.
without taking something. And
And now?
now I goes every morning.
Every morning.
Every morning.
With no help.
With no help. It's not twice a day yet, but I would love for it twice a day. But
coming.
once a day is better than
It's
not at
coming.
all.
It's coming.
Mhm.
You'll get there. So that's phenomenal. Constipation of 8, 9 years is gone, and no more assistance to get her to go. No other herbal formulas.
No.
No drinks. There's no enemas. There's no massaging the belly. There's nothing. And now we're fixing why. We're actually removing the
Right.
causes that nobody ever found. You had headaches for quite some time. And those were every day?
Every day.
How many years?
Sometime
How many years?
for a
later?
whole week. Sometime I have to go and lay down just to be balanced so I don't fall down. But it was like every week constantly.
And now?
Now I don't have any.
How long has it been since you have no headache?
A little over a month.
Over a month. How long has it been since you've had no constipation?
A little over a month.
How long has it been since you've been able to control your bladder and have no leaking of the bladder?
Oh, a little over a month.
More than a month.
It's
Yeah.
been
And
more
it's
than a
just-
month.
Yeah.
It's
been more
been
than-
Yeah,
it's been like from around November
Yeah.
to be exact.
So we're looking at 3 months now.
Yeah.
We're looking at 3 months of these results sustained.
Right.
That's the important thing for people to know, is that we're actually getting rid of the reason why, the hidden infections
Yeah.
and toxins in different tissues, which you'll see in another video that's going to be blended in with this video, merged in with this after this discussion with these ladies. But it's sustained for about 3 months because we're removing the causes. Thank you for putting that in. You also had a tightness in the foot that you said is gone.
That's gone.
You had a rope-like pain around your legs.
That's gone.
That's gone. You weren't able, so again, you said the insomnia, you didn't use the word, but you're sleeping at night now.
I'm sleeping.
You get up once to go to the bathroom. And there was also, you said that you had like a jumping foot that was going on as well. A restless leg kind of jumpiness. Does that look okay?
Yeah, it's about, normal. It's, it's not as 100%, but it's better than it was.
And the stomach pain, the last topic is the stomach pain you had was, and I know your daughter, I don't know if she wants to jump in again because she's been so good at sharing with people, but the stomach pain was, you told me it was so severe you couldn't even sleep at night because the stomach was hurting so much.
There's been, for example, like when we went to Houston, the doctor that we saw there, he did some treatment and he gave some remedies, and then he told us, she had to get away from the fruits altogether. No fruits, no fruits, no fruits, no fruits. And then we were prescribed some, to use the Himalayan salt. She were told to use that on a regular. So it was like we went to the doctor's office, we did what we had to do, and then we went home, and she felt pretty good that day, after some of the chiropractor, the body massages and everything. And then, like, we said, okay, so we're in a foreign town, let's do some shopping, let's get around, and we did. And we stopped and we got, she got a healthy sandwich. She got a nice healthy sandwich because at that point she never ate meat. And that's why we don't understand why she was still sick to the extent that she was. And basically, to cut a long story short, we got, it was what they call like a green drink that they made for her, and they put a fruit in it. And that night, she went home and we couldn't sleep. And like, we didn't know what went wrong. And then it was like, we went right back to the point of where we had to start using the hot towel in the stomach to get the muscle jumping and the cramping and everything to calm down. And it went away when we went back to the doctor the following day. It went away. And then like she was okay, no fruits, because that's what he told us the remedy was, no fruits. The fruit juices was the issue. And then we went back home and we started following what the doctor said in its entirety. Didn't miss a step, didn't miss a heartbeat. Regiment. And the problem persisted. We went back to the heating pad on the stomach. We went back to the enemas. We went back to everything just went back to normal, because like I said,
not normal function,
earlier,
but it went back to your
no,
original.
just when I say normal, it went back to the normal pain coming back,
Yeah,
the regular pain coming back.
Right.
Then you have the regular spasm, and then no matter what she eat, at the end of the night she can't sleep, or she only sleep for like an hour, and then she's back up. Then she uses the bathroom, and then she start having the churning in the stomach again. And then I'll be up like, what happened? Why is it happening again when we would have already gone through this? So now to see that just with the protocol that you've given her, the stomach has calmed a lot, and she has moved back to one of the family islands in the Bahamas. And, you know, I call her repeatedly, and I'm like, so how's the stomach? Oh, I don't even want to think about that. I ain't had that in so long. Let's just not talk about it.
About the bad things,
you know, just forget about it.
Yeah.
And so, honestly, I can say that from like about late September, late October, November, consistently, she has not had the pain. She's not had the irritating muscle issue that she's been having. Because she always explained it as it feels like somebody's in her stomach just doing this, you know, and it kept her up. And then there were points when, you know, I would go and I would help her massage her stomach when she used to have the pain. And you could feel it like something in the stomach just like continuously jumping, you know. But now it's to the point where she's not even having it at all.
Excellent.
She's not having it at all. She's not having the pain. She can sleep in the middle of the night. Like she said, she gets up once a night. And I think she might have fibbed a bit when she said she gets up once a night, because she didn't get up last night at all.
Yeah.
So it's some wonderful improvements. It's been some great improvements, and you know, we're gonna stick with it and see if we could get 100% back to, you know, where she is, you know, really functioning 100%. But I can tell you now, she's back into her gardening. She's back into her beaching like she used to be before. And she stays outdoors a lot like she used to be before. One time ago, she was more confined to the house because she was always in pain. So when the pain sits, she needs to be to the closest sofa or to the closest bed. So then now she's even, like on the island, they'll go to the far north side on the beach and they'll sleep overnight. She can go back to doing that now. So it's happening. And then when I'm saying, you're sleeping out tonight? Yeah, we're sleeping on the beach underneath the blanket. You know, things that hasn't happened in years.
Celebration.
Yeah. It's more than celebration time. Excellent. You know.
Thank you for sharing so much.
It's been wonderful.
I'm happy to be part of your team to get her to recover.
I'm happy that you are.
It never would have happened.
Yeah.
Now it's happening.
Yeah, it is.
Congratulations.
It is.
Thanks to you.
You're welcome. Okay, thank you. Stay tuned for the next video.